Well, I'm back with you for another Fireside Chat. Today's December 9th, and so this will cover the next few days. We have some information for you today, some good news and some adjustments that we're having to make and some other good news. So I'm looking forward to spending the time with you, and thank you for your time. Tomorrow, we'll be having the annual staff Christmas gathering. Each year we have a significant event with lots of staff showing up and lots of laughs and fun and a meal, and Rolling Green provides a meal and certain handouts and door prizes and those kinds of things. And one of the things that the staff looks forward to the most is the gifting that comes from you. And I have to say thank you. Over $127,000 was donated by the residents this year to be shared amongst the staff that we have. And every penny of it goes to staff. It does not go to the managers. It goes to the staff, and they really appreciate it. And the amounts this year are the highest I've ever seen. And so we are so grateful. And tomorrow will be a wonderful day, and we'll look forward to it. The party and the gathering will be a little different because we can't all gather together just because of the COVID restrictions and all that kind of stuff. But we are still providing a meal. We've got the door prizes, and we'll have a really nice time together. So again, words can't express how much we appreciate what you have given. And you'll be hearing more from staff about that. Wanted also to speak a little bit about the vaccine mandate. In September, President Biden issued a mandate that all healthcare workers should be vaccinated or have an exclusion for religious or medical reasons. Centers for Medicare and Medicaid Services issued specific rules for that in early November. And a number of hospital systems in the area and healthcare systems and so on actually met that mandate. In early December, a federal judge ruled that rule should be set aside for a time. And CMS has now appealed that rule. The issue that we have at Rolling Green Village is we were going to be date certain by December 5th. And in fact, we were. We know that if CMS prevails in their court case against the injunction, what will happen is they will make the rule effective immediately, and then they will come and enforce the rule for Rolling Green immediately. So therefore, we move forward with the mandate. And as of today, we essentially have all of our staff either vaccinated or with appropriate exclusions for religious or medical reasons. So we're very proud of the staff. Someone asked me if we lost a lot of staff for that. No, we didn't. We actually didn't lose any staff specifically because of that reason. We have lost a few staff along the way, but not as far as we know due to the vaccine mandate. So we've been very successful, and I'm excited because it helps protect you, as well as our staff's families and coworkers. So I'm excited about that. In the next few days, you're going to be receiving a letter about an adjustment in meal service. What we've found is last night, some of our staff was here till after 10 o'clock preparing the dining room for you today. And that was about 3 hours after their shift ended. And we are finding also that we can't find sufficient staff. Now, the other day I had someone come up and say, well, you just need to pay people more. Well, actually we're paying very competitive wages, and we have a number of discrete steps that we've taken to find additional staff. And really, right now, the area that we're hurting the most is on servers. Other areas we're doing pretty well, not as good as we'd like, but as you know, we've closed down rehab for a time on a temporary basis until we can find some additional nurses to help us staff that area. And we've actually found housekeepers, and so we're thrilled about that. I was talking to a friend of mine in another community, and they are short by 30 servers, and that's about what we're short as well. I just read a survey of 110 continuing care retirement communities, and what that survey said is that 75% of us have increased our wages, and all of us are having significant issues with finding staff. Because of this, we've done the buffets and some other things, and you may have actually seen some of the housekeeping staff working in food and beverage and some of our other staff working in food and beverage, just trying to get the meals served. But it's not working very well. We recently had one staff member who worked full-time as a server, found a job that has $4 or $5 an hour more in a bank, not even in the same field. And by her leaving, if we have one staff member call in the evening, I'll just use the vernacular, the service for that evening will be hosed. We will not be able to be successful, and it won't be good for the residents, and it won't be good for the staff, and it won't be a good experience. So what we are going to do is we figured out a way that actually will improve the quality of service and move us pretty much as we can away from the buffets as possible and move us back into ordering from the menu. And the way we need to do that, though, is adjust the hours of the dining room. Now, we'll always serve breakfast, and those hours don't change at all. So not worry about those, that for those of you who are early risers. The noon meal will actually be for the main meal for the day, and the kitchen will be open from 11 in the morning to the last seating at 4 o'clock in the afternoon. For those of you who like to eat later in the day, we are going to have a pickup service where you can order the meal in advance and you can pick it up at 5 or 5:30. Now, I know this is a change and an adjustment for when people eat, and that's difficult in some cases, and we cannot think of another way to resolve the issue with the staffing and provide you with a higher quality experience than you're having right now. And so we are needing to do this effective starting Monday, December 13th. It's a decision none of us like, but it's the only way that we can figure out to provide a better quality meal and experience for you. And we just thank you for your understanding with that. Again, there will be a letter coming to you with the detail of this, and you should receive that tomorrow or the day after, Friday or the day after or so. We are continuing to look for additional staff, and we haven't given up, and we anticipate that this will be temporary. We just can't say how temporary this is because we just don't know. And this is, as you know, a national issue that we've all heard about. And so we are making the adjustment. But one thing I'm really confident of is by having meal service with the menu ordering once again returned to you, the quality and the experience of dining at Rolling Green Village will be much better than what we're experiencing now, and that's something I'm actually pleased about. And I do need to thank Bruce and Jen and Rich and just the leadership staff over there. They've been working very, very hard to figure this out and figure out how to best provide a good quality meal experience for you. And just kudos to them. I do have some good news. Monday, December 13th, we are opening up visitation for all children. So we're well before Christmas time and kids can visit. We strongly encourage those that can be vaccinated to be vaccinated. And of course, one thing that we do require all visitors in public areas are to be wearing masks at all times in those public areas. And I've been noticing that there's been a little bit of laxness around that, but we request, and in order to keep you safe, especially with the new variants and those kinds of things going on, all visitors, including children. Now, children under 2, they really can't wear a mask, and we understand that, and so that's fine. Children under 2 do not need to wear a mask, but other kids, they can wear them, and we just ask for all our visitors to help us stay safe, and yet at the same time we want visitors to see our residents. So I'm excited about that. There aren't any other changes in sizes of groups or anything like that, so we can still use the Blue Ridge rooms for events and the dining room and those kinds of things. So those are all good things. And so we're excited about this. I know we've all heard about the new variant, and as we hear and understand more about that variant, we may have to make changes. But for now, and at least over Christmas, we are in business, and we want you to be able to see your family here, and we're excited about that. Again, I want to say just how much I appreciate the gifting for the staff. It's incredible. It's overwhelming, and we are so grateful. And I also want to wish you a Merry Christmas, a belated Happy Hanukkah for those of you celebrating that, and just a blessed and wonderful New Year. Thank you. Have a good day.